But first I want to talk about why you might not experience the fetal ejection reflex. I'm going to take the baby off the vulva actually. I talked a little bit about OP, right, when the baby's facing forward, and OA or anterior when the baby's facing back. So they enter on the side and then they rotate like this and they descend through and then they come out. So when they engage in the side and then they do that rotate before they're ready to come out, that rotation is happening around transition near the end of labor. And when that rotation happens, sometimes babies will just turn like this. I would say most of the time they just turn back like this and they come out. Sometimes though, they engage like this and then they rotate like this, trying to go around to the back. They take the harder route. I don't know why. If your baby decides to do that, what could happen if there isn't enough space in the area, if there isn't enough softness and flexibility in the musculature surrounding the pelvis and the pelvic floor where they're moving around, they could potentially get stuck here and then just decide they want to come out. Other babies will engage a little bit more OP or posterior anyway, and they'll engage like that and then they just rotate OP because they're like, this is the way I'm doing it. You know, they just want to be OP. And I think that the babies are very wise in knowing what is the best position for them to assume to be able to navigate the pelvis. That's their job. It's really incredible that they know how to do that. And I think a lot of the time the babies will assess the pelvic floor, assess the pelvis as they are engaging in and out at the end of pregnancy, and then they just decide this is where I can access the most space, so this is how I'm going to orient myself, and then they do. And if babies are born directly posterior, that's okay. It can make labor sometimes a little longer and a little more uncomfortable, which is why it's ideal for baby to be turned back, but this sometimes can happen. Doing the spinning babies is what supports your baby in coming out like this in an anterior position, and also engaging in a position that's a little more anterior like this. When your baby comes down into the vaginal canal, this is when you might not experience the fetal ejection reflex. If they're facing forward, what can happen is, do you see this space on the back of the head? If you look at it this way, there's a space, and if you look at it this way, there's a face protruding out. And so this is where they will stimulate that fetal ejection reflex called the Ferguson reflex. If they're engaging like this, that reflex isn't getting the same kind of pressure that it would be like this, because the whole face, and the face is flexed, so it's like face and body, so they're getting like this full constant like pressure and stimulation, and that might not happen like this. I have seen people have the fetal ejection reflex with the baby posterior, and I have seen people who are like 10 centimeters and we check them and we wait hours and hours and time to start pushing, and they're just not, you know, pushing, and then we have to give them some guidance and coaching and support them, and it takes a lot more work to get baby out, but we've always been able to do it. Just wanted you to know that that's a situation where directed pushing can be a little bit more supportive, but that doesn't mean that having you lie on your back and hold your legs back and hold your breath to the count of 10 and push as hard as you can, like you're having a big poop, that's what they'll say, is the most beneficial thing for a posterior baby. Probably what would be more beneficial is to receive some gentle guidance, which would probably involve inviting you to, like, when you have a contraction, to bear down, engage your tummy muscles, do everything that your body would normally be doing with the fetal ejection reflex. So you're like wanting to try to push down, but you don't have to like push so hard that you're straining yourself. It's more like give it like a nice, you know, engagement and a solid push, but don't like hold your breath for 10 whole seconds while you're pushing as hard as possible. Just with the contraction, you can give it some pushes. And usually if you get baby down a little lower, then the reflex will kick in a little bit more. So also sometimes, rarely in those circumstances, having someone give you a little bit of support by putting their fingers on the inside of your vagina at the bottom and pushing down a little bit, that can give moms a focal point for where to push. So having fingers in the vagina is something that I recommend avoiding most of the time when you're pushing, because it's unnecessary. If you're in this circumstance, sometimes that can be really helpful.